So we're recording now. Okay, we're going to start up with the next system that we're going to talk about, which is called the lymphatic system. So you've all heard of lymph nodes. You know, when your kids have a cold or when you had a cold, the doctor's rubbing your neck, feeling for bumps on your neck and different things. So your lymphatic system has many different functions. On an EMT level, we don't really get into it. I've never seen a question on the state exams, but just so you understand, because again, the population you're going to be serving is going to call you and expect you to be, doctors when you get to their house. So just understand, the lymphatic system does a couple things. Okay, it captures certain fluid called, which we call lymphatic fluid or lymph. Okay, so it's kind of like another set of blood vessels in your body, but it's not transporting blood. It's transporting another fluid called, like I said, called lymphatic fluid. Okay. And what that fluid does is helps keep your body, your amount of fluid in your body balanced. So it kind of moves fluid around inside of your body to keep the amount of fluid that we need balanced. And we really are made up of, we think our weight is mainly bone and skin, but actually most of our weight is fluid. 60% of our body weight is fluid, which is why we don't do very well. When we fast, the thirst seems to be more of an issue than the hunger because we have so much need for fluid in our body. Now, the big thing that we talk about on an EMT level as far as the lymphatic system goes is infection control. So, when you have a cold, or your kids have a cold, you feel their lymph nodes being enlarged. The lymph nodes make substances to help fight infection, just like the white blood cells when we were talking about last night. We said help fight infection. There's many different substances in your body that help fight infection. And the lymphatic system also does it. And there's nodes throughout the body or little areas throughout your body that, hold on one second, that play a role in infection. So let's say like you've heard kids taking your tonsils out, right? So your tonsils are actually part of your immune system and they actually secrete or let stuff out of them that helps fight and kill germs entering into your body. So if they're chronically enlarged and causing problems with the child breathing at night and colds and stuff like that, they would have to take them out. The same thing sometimes when they take out the tonsils, they take out the adenoids, which is another structure in your throat that helps to fight infection. Obviously, they're in your throat because that's one of the ways that bacteria and viruses can enter our body. Okay. Your spleen is also part of your lymphatic system. Remember, your spleen is the organ in your upper left quadrant of your abdomen. Okay, it's a very vascular organ, which means it has a lot of blood going through it, and it's a very common organ to get injured in trauma. So when we get to the trauma section, you're going to see that they speak a lot about what they call splenic injuries. So the spleen is referred to as a splenic injury. Okay, but again, part of your lymphatic node. So again, there's not going to be any test questions. There's not going to be anything we're going to do treatment-wise or anything like that. But just to realize that there's multiple systems, okay, multiple structures that make up what's called your immune system. And we get a little later into class tonight, we'll talk about the immune system. Okay, now, the real reason I speak about it is that you're going to come across patients where we're going to tell you not to take blood pressures on them, or at least not to take blood pressures in certain parts of their arms and stuff like that. Now, somebody's chatting. A node is, somebody's asking, what is a node? So a node is basically, I don't know exactly how to describe it, but it's a structure, it's a thing in your body that secretes or lets loose substances to help fight infection. So it's like a little, I don't know, a little, I'm trying to think, like a little tiny pump. You ever see when you walk in the bathroom, this thing on the wall that's spraying out stuff to make the room smell? Well, that's what kind of nodes are. They let things loose into the body to help fight infection. Okay. Now, the real reason we're talking about it is when a woman has a mastectomy means that she had a problem with her breast, usually cancer, and they had to take breast tissue, right? They had to take part of her breast tissue or all of her breast tissue out. In that section of the chest where a woman's breast is, there's also a lot of lymphatic vessels, a lot of where the flow of the lymph goes through. So when they have to cut out all the muscle and breast tissue, there's no way to avoid taking all the lymphatic with it. So because they've taken out so much pressure, so much fluid, it's hard, so much tubing, it's hard for that fluid to travel. So one of the things that we always avoid is taking a blood pressure, okay, in the arm on the side that a woman had a mastectomy. Now, if a woman had a bilateral mastectomy where both breasts were removed, then that means we can't take a blood pressure in her arm. Usually it's one-sided, okay, and we just wouldn't take a blood pressure in that arm because it just raises the pressure in the lymphatic system when you're kind of using the blood pressure cuff to tighten on the arm. Now, I have to say, again, because of the population you're going to be serving, it would not be so common if you asked a woman for her medical history, uh, for her to tell you that she had her breasts taken out, right? She'd had a mastectomy in the Jewish world. So women, in general, they don't tell you much of anything. And they're sure probably not going to tell you it's a mastectomy, but they've probably been warned by their doctors that they should not have a blood pressure taken in the arm that they had a mastectomy. So if you go to put the blood pressure cuff on them to take a blood pressure, you may see that they're telling you not to do it. They may not tell you why they don't want you to do it, but that is probably the reason. The other patient that we would not take a blood pressure, okay, on their arm is a dialysis patient. So a dialysis machine is a machine that somebody who has kidney failure, renal failure is put on, and it's basically a machine that takes the place of the kidneys. So last night we were talking about that, there's the good things in the body and there's the bad things, and the waste products are the bad things. And we said that the lungs get rid of the carbon dioxide and the kidneys and the liver help to get rid of a lot of the other bad parts. So if somebody has renal failure where their kidneys are not working, one of the ways they could stay alive is they're put on an artificial machine that kind of takes their blood and cleans it for them. Okay, so a patient who has a dialysis shunt, which is where they've connected the blood vessels in their arm to be able to connect it to the machine, cannot also take a blood pressure. So this is what the arm of somebody who has a dialysis shunt in it, okay, looks like after a couple of years. They get these very enlarged blood vessels on their arms, almost looking like varicose veins on their arms, okay? And that would tell you, that they have, if you were to like roll up their sleeve to take a blood pressure and you saw that, that would kind of warn you that they have a dialysis shunt in their arm, and you would not take a blood pressure on it. Now, sometimes the dialysis shunts are put in their chest, so obviously their arms would not be an issue. Okay, but if it's in the arm, we wouldn't want to take a blood pressure. And there are sometimes, these shunts are not good forever. So there are some times where patients have had one arm all used up and they've had to go to the other arm, in which case, again, we could not take a blood pressure in their arm in that situation. Okay, so just in review, there's two times we would not want to take blood pressures on people's arms. One is a woman who's had a mastectomy, which means that breast tissue has been removed. And if it's a one-sided mastectomy, we wouldn't want to take a blood pressure on whatever side she had it done on. If it's bilateral, both sides, then we couldn't take blood pressures on her arms. And the same thing like a dialysis patient, we wouldn't want to take a blood pressure on the arm that has the dialysis shunts in it, because this is a surgical procedure where they actually bring an artery and a vein together into a special kind of tubing, and that's what they pierce with the needle every time they hook them up to a dialysis machine. So it's a very expensive and lengthy process. So we don't want to screw it up by taking a blood pressure on them. Okay, so now getting to like more of the important stuff. So the nervous system. So your nervous system is your computer of your body, which is your brain. Okay, and the wires that the signals go through. So obviously the signals go both ways. You have signals going to the brain telling it stuff, and then you have the brain telling the body to do certain stuff. Now, the brain controls pretty much everything in your body with the exception of the heart, obviously, because we said the heart has its own built-in pacemaker site that controls it. So we have both voluntary parts to our nervous system and involuntary parts. So what it means is we have parts that we control ourselves, and then parts that we don't have to control because the brain does it for us. And obviously the things that are involuntary are the things that we need to stay alive even when we're sleeping, right? So that would be breathing, that would be digestion of food, that would be the diameter or the size of your blood vessels, because remember, your body has the ability to change the size of your blood vessels depending on how it wants to move blood around in your body, okay? So we're going to talk about both the voluntary side, the involuntary side, okay? And then obviously from the standpoint of the brain is the organ that allows us to function, right? It allows us to be awake, it allows us to process information, it allows us to react to that information. And we do that because we have five senses, right? We have sight and we have vision and we have taste and we have touch. So we have different senses that bring all that information into your brain, and your brain processes it and makes a decision on what to do, okay? So the brain kind of coordinates all the other systems in the body with the exception of the heart, and keeps everything working the way it should work on a regular basis. And it's not that your brain can't, um, I guess, modify your heart, the rate of your heart. It can definitely slow it down or speed it up. But as far as the actual beating and telling it to beat on a regular basis, the heart does it itself. So if I scared you right now, the reason you knew you were scared is because your brain told you were scared. And when your brain senses you're scared, you'll see that it secretes a chemical into your bloodstream that some of you have heard about already, adrenaline, or the medical term for adrenaline is epinephrine. And what epinephrine would do would speed up your heart rate. So, your brain can um, change or alter, your basic heart rate. But as far as the heart knowing to beat on a regular basis, that is controlled by the pacemaker sites in the heart. And if you remember yesterday, we said there's multiple sites inside the heart, because in case one fails, there has to be a backup, and that the dominant or the most important pacemaker is high up in your right atrium, and that's called your sinoatrial node or your SA node, and that was set for a rate of 60 to 80 beats per minute. And that should be easy for you to remember because that's pretty much our normal heart rate, right? If the pacemaker is set for 60 to 80 beats per minute, then obviously that's what our heart will beat at. If that were to fail, then there's another one a little lower down in the right atrium, okay, called your AV node, and that's set for 40 to 60 beats per minute. And then your ventricles themselves can beat at a rate of 20 to 40 beats per minute. So even if the higher systems fail, your lower systems would work. The problem is that the way the heart decides which pacemaker to listen to is whichever one's going the fastest. So it can't set all the pacemakers to go at the same rate, or none of them would be in charge. So the problem is if you lose your most important one, your SA node, that means the best heart rate you're going to get is off the AV node is 40 to 60. And if you lose both the SA node and the AV node, then the best heart rate you're going to get is 20 to 40. And I think you figured out already that, if the normal heart rate's 60 to 80 and your heart's only beating 20 times a minute, you'll be still somewhat alive, but you're not going to be awake and functioning and stuff like that. Move my mic closer to my mouth. My mic should be right in front of my mouth. Is it better now? Yes? Okay. So anyway, that's the pacemaker. So, what I was basically trying to say here is that you're going to see in a second as we go a little further that your nervous system, your brain and your spinal cord and all the other nerves of your body, it is the main computer that controls everything. And it can alter your heart rate, but the heart itself has the ability, like I said, to initiate its own impulse and beat on its own without any influence from the brain. So if somebody was actually, God forbid, in a terrible accident and their brain was damaged to the point they're not awake anymore and everything, their heart would still beat on its own, okay? Now, the heart does need to be fed. It does need to have oxygen. It does need to have all that stuff. So if somebody's brain is so badly injured that it's not controlling breathing, because you do need your brain to control breathing, that person would have to be on a ventilator, okay? But as long as they're getting air and oxygen and being fed, even though their brain is damaged, their heart will continue to beat because the heart has its own brain inside of it to be able to beat. Okay. Okay, so what's the function of the basic functions of the nervous system? So it controls and maintains a state of awareness. What does that mean? It's what keeps you conscious. It what keeps you aware of what's going on. Okay, so obviously somebody who has an injury to their brain, one of the most classic signs of an injury to the brain is the loss of consciousness, or somebody keeps on saying, in class, an AMS. AMS stands for altered mental status. It means that the patient's not thinking clearly. Okay, it transmits sensory stimuli to the brain. So what does that mean? You touch something hot, okay, and one of your senses is touch, and it transmits that back to the brain and says your hand is burning, okay, and you pull your hand away, and that all happens in a millisecond, right, instantaneously. Okay, and then we talked about there's voluntary functions like walking and chewing and stuff like that, and then there's involuntary functions like breathing and blood vessel diameter and that stuff, okay. And then we're going to see in a second that there's different parts to our nervous system. So the autonomic nervous system.
How is that called? The one with senses like you got the burn or the other things? Is that a voluntary, or it's not a voluntary because you're not controlling it?
No,
Is it
is actually,
automatic?
it is part actually of your voluntary nervous system. I'm going to explain it all in a second, but it is actually, because if your hand was like, some people can touch something very hot and keep their hand there. Other people, the slightest, little increase in heat, they pull their hand right away. So it's voluntary because you do
Basically
it.
control, but not a voluntary. That you're not saying that, you're not telling them when to do what.
I don't know what you're trying to say.
A voluntary is what you have to tell them to do. Let's say I want to lift my hands.
Mm-hmm.
You
Right.
tell me when to do it. Involuntary is like breathing, but you can control it. You can make it deeper and shorter and
Right.
faster. But the one what senses the when you touch something, can you feel something?
Hmm.
Then it goes like automatically, but it might be controlled. You can leave your hand over there, even that's hand. But it's
Yeah. So I
also
mean, some things we'll say are involuntary, right? Like you said, breathing technically is involuntary, and you're right. Okay, so we don't have to really control breathing, but we can change it or modify it. So there's some things that are a little bit of both, and let's just go through it, and we'll hopefully explain to it. And if not, at the end, we'll go over it one more time.
thank you.
Okay, you're welcome. Okay, so the main division of your nervous system is called your central nervous system, and that's made up of your brain, which is the computer, and the wires off the brain, which is the spinal cord. Okay, so if you remember, again, I'll show you pictures in a second, but if you remember, the way it works is that your brain is obviously in your skull, and at the base of your brain, your spinal column, right? Your skull is sitting on your spinal column, which we said is made up of 33 vertebrae, right? Your cervical spine, which is your neck, has 7. Your thoracic has 12, right? So thoracic being chest, okay. Then you have your lumbar, which is your lower back. So 7, 12 is 5. Then you had your sacral and your coccyx. So 7, 12, 5, 5, 4, which makes up 33 vertebrae. So those are the bones that allow us to stand upright. Running through the center of the bone is the spinal cord. So the column is the bones, the cord, okay, is the nerve or the wire that's taking the information from the computer or the brain, okay, and coming down. And at each level of those 33 vertebrae, there's other nerves coming off of it, then send signals and receive signals and send signals to all parts of your body, okay? So on the test, they're going to say, what are the components of the central nervous system? That's the brain and the spinal cord, okay? Now, that's your main nervous system. Then you have a peripheral one. Now, if you remember when we said something's peripheral, it means it's like not in the center of the body, it's out to the sides, right? So peripheral is further away from the center of the body. So central is the brain and spinal cord. Peripheral, okay, is made up of 2 divisions. It's made up of the voluntary side, okay? The voluntary side has 2 sides to it. It has a sensory side and it has a motor side. So it has wires that are bringing in senses, and then once the brain processes those senses, so what you have is all these nerves coming from your eyes, your mouth, your nose and stuff, right? They're going from those structures, from the nose, say, back into the spinal cord, okay, and back up to the brain. And the brain is processing it. Now those signals travel like that, right? So you can smell something, your brain, as soon as you smell it, your brain recognizes it, and then you either decide that the smell is good or the smell is not good, and that will decide what you do with it. Just like if you're touching something hot. So you touch something hot with your finger, a nerve in your finger picks up that it's hot, it sends a signal up your arm, okay, all the way, right, across your chest to the spinal cord, and then up to your brain. Your brain immediately processes it and decides if it's going to tell you to move your hand away or that it's not that hot, you can keep your hand in place, right? And it's going to send that signal back. If you have to move it away, as soon as it processes it, it's going to send that signal back down through a different nerve, through a motor nerve that makes you move something and move your arm away. And it all happens like that, right? And you know that your senses are very, very quick. So there's 5 senses that provide information to the brain, okay? There's sight or vision, right, with your eyes. There's taste, okay, with your tongue, okay? There's smell from your nose. There's touch from your fingers. And actually, there's touch from every ounce of your skin, okay? So, if a mosquito lands on your skin, right, the hair on your arm senses it, and you immediately know there's something there. So the sense of touch, is really probably better said feeling, but that could be anywhere in your body. It doesn't just have to be your fingers. And then hearing from your ears. And besides your ears doing hearing, your ears also play a big role in balance, right? So you ever see like a level you put on a piece of wood, it has a little vial with water in it, and as you turn it, it basically, that water moves. Well, you basically have the same thing in your ears. So if you ever get an ear infection or, some problem with your ears, your biggest problem is balance, right? You feel like you can't walk in a straight line. So your sense of balance comes from your ears, and that information is then sent to your brain to process. So if you were to be, I don't know, if you fell through a huge pile of snow, and you couldn't, for your eyes, you can't see because you're inside of the snow, you can't see if you're upside down or straight up. your brain would figure that out based on your balance from your ears, knowing which direction you're in. Okay. Okay, so your voluntary side has the sensory nerves that are bringing the information to the brain. Then the brain tells you to do something through the motor nerves. Okay, so if you were to, I don't know, get out of your car and you saw somebody that looked dangerous, okay, so your eyes, your sight would be sending a signal to your brain saying, that guy doesn't look good. Okay, your brain would process it in a second and then send information to your arms and legs to probably make you go back in the car and lock the doors. So that's kind of how the voluntary side of the peripheral nervous system works. And then on the involuntary side, we call that the autonomic nervous system. So the way to remember that this is involuntary, autonomic sounds like automatic, right? Which means that something's happening automatically. We don't have to control it. So the autonomic nervous system is the nervous system that runs automatically, okay? And it controls involuntary motor functions. In other words, things that have to work no matter whether we're awake or not awake. And the main ones would be breathing, okay, the movement of air in and out, digestion, the processing of food through your body, okay, and the diameter of your blood vessels. So again, you have to maintain your blood vessels at a certain diameter to make sure blood flow is good, right? And I mean, just, so if you are resting in your chair and relaxed and your body wanted to lower your blood pressure and make your heart not work so hard, it would relax your blood vessels so that the heart doesn't have to pump as hard. If you're now going to jump up, okay, and it wants to maintain a certain blood pressure because you're now standing up, it's going to constrict those blood vessels so that the pressure stays higher even though you're standing now. Okay. So again, two divisions: central nervous system, peripheral nervous system. Central is made up of the brain and the spinal cord. Peripheral is made up of two divisions: the voluntary, which has both sensory nerves and motor nerves bringing information into the brain, and involuntary, okay, which is the autonomic nervous system. Now, a lot of information. Again, the main stuff on the test that they're going to ask you are, what are the two big divisions of the central nervous system? That's the brain and the spinal cord. The brain is the master computer that's basically controlling the body, processing information, and telling the body to do stuff, okay? And the spinal cord is the way that information gets from the brain to all parts of the body. So yesterday we were talking about, well, actually 2 days ago, we were talking about breathing, right? And we said that the body knows to breathe because it's monitoring the level of carbon dioxide in the bloodstream. So how does it do that? Well, there's special nerves in the bloodstream that monitor the level of carbon dioxide, and it sends a signal back to the brain telling the brain how much carbon dioxide is detecting, okay? So let's say the carbon dioxide level in your bloodstream is rising, it's getting higher. So it's going to send a signal from your blood vessels through the spinal cord up to the brain. The brain's going to say, uh-oh, the carbon dioxide level is rising. I need to tell that person to breathe faster and deeper to bring in more oxygen and get rid of more carbon dioxide. So the brain's going to send a signal back down the spinal cord, okay, to the nerves that control your diaphragm and your intercostal muscles, which are your two muscles of breathing. And it's going to tell those two muscles to start working faster and deeper, so you bring in more air and you breathe faster. Okay, so that's kind of how it works. So it's kind of a little combination of everything there to make it work. Okay.
So let's say
Now,
shortness of breath can be from that because there's too much carbon dioxide.
sure, if you're well, the sensation of shortness of breath can be caused by a million things. It could be psychological, like you're scared, or it could be what they call physiological, which means there's really a problem, right? So I mean, sometimes people have panic attacks and they feel like they can't catch their breath and there's no breathing problem. So that's all psychological. So, as we go on, we're going to talk about the more common things that cause people to have sensations of breathing. And that's a hard thing, for an EMT. You go to somebody who says, I feel like I can't catch my breath. And you look at them and they look like they're breathing okay. You put them on a pulse oximetry, the numbers are good. And you're kind of like, well, are they a psychiatric patient or is this really a problem? So I always take people at their, what they tell me. So if somebody says to me they feel like they can't breathe, I feel it's not up to me to say, okay, they're crazy and everything's fine. I would rather say, okay, let's put you on some oxygen. Let's see if that helps. Okay. And take them to the hospital and let them figure it out what's going on versus finding out that you tell them it's a psychiatric problem. Okay. And then there's truly a medical problem that you didn't, treat and didn't take the patient to the hospital. Okay. So they're not going to ask you about all the divisions of the brain. So you can take a deep breath. You don't have to worry about that. But they are going to ask you what part of the brain, okay, controls breathing. And remember, so that's going to be an involuntary muscle, okay? And it's called your medulla. You see it right here, medulla oblongata. Most of the times we get away with saying brainstem. Technically, the brainstem is made up of two parts. Now, where's your medulla? Your medulla, this is your spinal cord, okay? Remember, this goes all the way down to about your lumbar, your lower back, okay? And off of this, at every vertebrae, you see how they're showing bones here? There's 33 sets of bones going all the way down. That's our spinal column. And then the spinal cord is the wire or the nerve that goes through it, okay? Your spinal cord comes up and your skull has a hole, right? This is all your skull, right? Sometimes it's called your cranium, right? This is all your skull. At the base of your skull, there's a hole in it where the spinal cord comes up and connects to the brain. So where the spinal cord and the brain connect is called your brainstem, right? So this whole structure to right about here is your brainstem, okay? The very base of your brainstem, where it meets your spinal cord, is called your medulla oblongata. In there, there's two important functions that are controlled in there. That's where it's looking at your level of carbon dioxide and oxygen and deciding how often you should breathe. And that's where it's also looking at your blood pressure and determining if it needs to increase your blood pressure or lower your blood pressure. How it looks at your blood pressure is, remember, your blood vessels are tubes. Built into the walls of the blood vessels are what they call stretch receptors. So if you stretch, it means that it's getting bigger, right? So what it's doing is it's monitoring how much pressure is on the blood vessel by how stretched the blood vessel is. So that if the blood vessel has the right pressure on it, it knows your blood pressure is good. If it senses that your blood pressure is not good because it's not stretched enough, then it would make your heart start beating faster to pump more blood, and it would actually start to constrict your blood vessels to keep it open, okay? So again, the whole thing in the brain, we really just need to know this part over here that it controls breathing. Obviously, your brain controls everything, and we'll talk about a second, just just so we cover it, all the different parts of your brain and what they cover. But on the test, really, the only thing they're going to talk about is the medulla. Okay.
So
Now,
that's involuntary and
yep,
medulla oblongata. That's okay.
yep, that's involuntary because it's controlling breathing and blood vessel diameter. And obviously, we're not going to be controlling that when we're sleeping, so it's involuntary. Very good. Okay, now your spinal cord, okay, I'm sorry, your central nervous system, we said is two layers, your brain and your spinal cord. It's covered by three protective layers. And it's a little bit of a confusing terminology, but the reason we talk about it is that when we talk about head trauma, right? So head trauma means your brain has been injured. We talk about different types of bleeding that happen underneath the skull and, between the brain and pressure and stuff like that. So there's three main layers, okay, that protect the brain. And since the brain and the spinal cord are all the same, they actually protect the spinal cord also. So there's the dura mater, and that means tough mother. Dura means durable, and mater is mother. So tough mother, that's the outermost layer. So this is showing you the skin of your scalp, your skull, which is the bone, and then under the skull is the dura mater, the arachnoid membrane, and then the pia mater, okay? So there's three layers. We're gonna go over it again when we go to head trauma. And what is flowing underneath these layers is the cerebral spinal fluid. So if you've ever heard somebody have to have a spinal tap, where they're actually taking out some spinal fluid and looking for signs of infection, this is the layer that they're actually going into to get the spinal fluid out. Now, they don't do it in your brain, obviously, but since your central nervous system, right, goes from your brain all the way down your spinal cord, and since the meninges or the layers wrap around the brain and the spinal cord, that fluid flows around the brain and the spinal cord. So what they do is they go down real low to where the spinal cord doesn't actually reach, but the canal, the passageway that the cord is in is there. And that's where they stick the needle so that there's no, remember, if you were to stick a needle in the spinal cord, you could damage the spinal cord and result in permanent injury. So they don't want to stick a needle and try to get it into this little narrow, corridor right in front of it. So they'd rather go down lower where the spinal cord doesn't really go, okay, and draw the fluid out of there so that there's no danger of paralyzing. And sometimes you may have heard that your wife gets an epidural for pregnancy, right? So an epidural, remember yesterday we talked about being above, right? So your epidural is the space above your dura mater, right? Epidural, right? Above it and under your skull. what the anesthesiologist actually does, and again, this is down low in the back, the lower back, is that they inject a medication, an anesthetic medication that numbs, okay, down low. And what it basically does is it takes away the sensation of pain, below a certain part of the body, usually about, the belly button and below, so that a woman who's having contractions to deliver a baby doesn't feel that pain. Okay, so that's what an epidural is. Okay, so again, we said there's different sections of the brain. Okay, we're most concerned, we said, about the medulla down here. Okay, so the cerebrium, okay, which is this big section up here. And let me see if I have a better picture. Okay, so the cerebrium is this big part of your brain, right? It's most of the brain. Okay, that's what basically controls you being awake, okay, knowing what's going on, okay, and remembering things. Now, you don't have to know this for the test, but you know that when people have an injury to their brain called a stroke, okay, that every person has a stroke has a different problem. Some problems are talking, some problems are moving their hands, some problems are eating. And that's because a stroke doesn't involve the entire brain. If the stroke involved the entire brain, the person would be dead. The stroke usually injures a part of the brain, okay, depending on where the block of the blood flow was, just like a heart attack injures a part of the heart, depending on where the block of the blood flow is. So when somebody has a stroke, depending on which part of the brain is involved and how much of the brain depends on what problem they have. And they call that a deficit, what deficit the patient actually has. Okay, the cerebellum, okay, which is this section down here, okay, mainly controls balance. So this is where your ear connects into your brain, and it mainly controls balance. Okay. So if people have strokes involving the cerebellum, they do not have good balance. They do, again, problems with muscle movement and stuff like that. Now, the part that we're mainly concerned with, we said, is the brainstem. The brainstem has a couple of different pieces, but the only thing they mention for EMTs is the medulla oblongata. Most of the times they don't spell it out like this. They just say brainstem, okay? And the medulla has three major functions or three major things it controls. Okay, breathing, okay. Cardiac, this is not really correct in the sense of actually making the heart beat, but it can exert some control over it. And then the diameter of your blood vessels. So vaso means vessels. So vasomotor is the constriction or the dilation of the blood vessels to change the size of it. Okay, so that's what your medulla controls. Okay, so the spinal cord extends, we said, from the brainstem, right? It comes up into the brain, it meets at the brainstem, and it's what takes the impulses from the brain, okay, and sends it to different parts of the body. And we said that at each level of the spinal column, each 33 levels of the vertebrae, there's nerves that come out sideways, and they send signals to all the different parts of the body, okay? So that's your central nervous system. Now, your peripheral nervous system, okay, we said has two divisions. It has the motor sensory, right? It has the voluntary part of it where it basically processes information. So it has sensory nerves. Another term for sensory nerves is afferent, but most of the times they call it sensory. Okay, so sensory nerves that carry impulses from the body. What were the senses? We said, seeing, tasting, smelling, touching, are all different, hearing, are all different senses. So they bring that information back to the brain, and the brain decides if it wants to do something with that information. If it does, it sends a signal through another nerve called a motor nerve or efferent nerve, okay, to whatever part of the body it wants to do something. So, if you smell something bad, it's basically going to tell you to turn your head in the, different direction and probably not take a deep breath. So, it depends, everything depends on what the sensory information is, what the brain tells the motor nerves to do.
How is the pronouncing of the two effluents?
Afferent with an A and efferent with an E. So afferent, efferent, E. Okay. Again, they're not going to ask you to pronounce, so you don't have to worry about that. It's more the spelling of it, but I've never seen on an EMT level exam anything about afferent and efferent. They will say,
Sensory motor?
what's that?
Sensory motor?
Yes, they'll say sensory motor, but they'll have a question. They'll say, which of the following is one of your five senses? Okay, so your five senses again are what? Just you touch. So you go your eyes, your nose, your ears, your taste, and your touch, right? So did I leave something out? 1, 2, 3, 4, 5, right? So So you have 5 senses, okay, and that brings information back to the brain, and it may say something like, your a patient touches a hot substance, and their hand is withdrawn from the hot substance. That signal is transmitted by and it would be a motor nerve. So we'll go over all these questions. You know, I don't know how to there's being a good EMT, and then there's passing the state exam. So there's going to be a lot of information that you need to pass the state exam that's not necessarily going to make you be a good EMT, right? So, but you have to pass the state exam to be an EMT. So like that's what I'm getting at. So there's stuff that I'm going to tell you, like the week before the state exam, we're going to meet every day, and all we're going to do is go over questions. We're just going to go over the wording of the questions because they ask it in ways that you're not going to understand the wording of it. And it's more or less just to teach you to answer questions in the way they ask them. Okay, because sometimes they'll say all of the following except, right? So all of the following except. So like I think yesterday we had one. It said all of the following are parts of the respiratory system except, right? So somebody will say see the sentence saying parts of the respiratory system, right? And then they'll see choice A being trachea, and they'll go, oh, okay, that's it. And they won't read B, C, and D, right? And then if they did read B and C and D, they're going to see it's trachea, alveoli, bronchioles, and esophagus. And they're going to say, well, it can't, something's wrong here because, there's 3 choices that are part of the respiratory system. So, how can I answer that? And then you go back and read the question and you see that it says except, right? So the except part would be the esophagus. The esophagus is not part of the respiratory system. So there's, part of it is just knowing how to take tests. Okay, so this is showing you again, right, how the voluntary side works, in that you have a sensory nerve, right, that's saying, I'm touching the flame of the candle. It's sending a signal up the spinal cord to the brain, okay, telling the brain that something's hot and it's uncomfortable. The brain then sends a signal through a motor nerve to your arm, making you pull your arm away. So that's basically how it would work. Okay, so the peripheral nervous system, right? We said we had the central nervous system, that's the brain and the spinal cord, and now the other nervous system is the peripheral nervous system. We had the voluntary side that we just talked about. Now we have to talk about the involuntary side. That's called the autonomic nervous system or the automatic nervous system, and it has 2 divisions, the sympathetic nervous system and the parasympathetic nervous system. Now, you've all experienced stimulation of both of these nervous systems, okay? So you almost got into a car accident and your heart is beating, your hands are shaking, you may break out in a cold sweat, okay? And what was that? So that was that your body sensed an emergency occurring and it activated the sympathetic nervous system. So your brain really saw, right, through your senses that you were going to almost get into an accident. And amongst a lot of other things it told you to do, probably hitting the brakes and turning the steering wheels, it activated your sympathetic nervous system, which secreted a chemical, a hormone, called adrenaline into your bloodstream. So your adrenal glands that make adrenaline sit on top of your kidneys. And anytime your body senses an emergency, okay, it will secrete this adrenaline into your bloodstream because that's your drug, that's your hormone that makes you have the ability to either fight or run, okay? The other side of the nervous system, so this is the gas pedal, the sympathetic. The parasympathetic is the brake that slows things down. So most of the times, what happens is the sympathetic gets activated. The emergency turns out either not to be true or it's done with. And now you have to slow things down, and your body will then activate the parasympathetic once it realizes the emergency is gone. Sometimes we accidentally activate the parasympathetic. So you've heard of stories of people who see blood and faint. You heard of stories that people are getting a strep test and the doctor's rubbing the back of their throat and they're gagging and they faint. You've heard of stories of people that were straining to go to the bathroom on the toilet because they were constipated and they fainted. So it is possible to stimulate this parasympathetic nervous system by accident. And if the sympathetic is the gas pedal, the parasympathetic is the brake. And when you stimulate it, what you do is you slow down the heart rate to low numbers, like below 50, and you dilate the blood vessels. So knowing the little bit about pumping of blood, right? If we were to take the heart rate and go from 80 to 40, and we were to take the size of the blood vessels and go from a normal diameter to 2 times as big, what do we have to do with the pressure of the blood going through it? That pressure has to go what? Down, right? It has to drop. So if your blood pressure suddenly drops and you're not getting enough blood to your brain, what happens with your ability to process information, right? Your brain needs oxygen and sugar to work, just like everybody, all parts of your body needs oxygen and sugar. So that if it's not getting that oxygen and sugar because you don't have good blood flow, what's going to happen to you? You faint. So that's what happens when your parasympathetic nervous system is activated, okay? So autonomic, involuntary, right? Automatic has two divisions, sympathetic, and it's abbreviated the fight or flight syndrome. So what does that mean? That when that's activated, it's because your brain is thinking that you either have to fight to save your life or flee, okay, to save your life. And what it does is it secretes a chemical called adrenaline, okay, or the real term is epinephrine, okay, into your bloodstream, and that speeds up your heart, increases your breathing, moves blood from non-vital areas of your body. So if you are getting attacked, you do not need to digest food, okay? So what it does is it moves the blood from your digestive system, okay, to your legs, your arms, okay, to your lungs, to, in other words, to your legs so you could run, to your arms so you could fight, to your heart and your lungs so you could breathe faster, right? And the body has the ability to shift everything around. The classic thing I would say is how, like, let's say like something common you've experienced with this, okay? Somebody just asked, why do we need more blood when we're running? Because to run, what do we have to do? Muscles have to move, right? So for muscles to be able to make energy, what do they need? They need sugar, okay, and oxygen. And what brings the sugar and the oxygen? The bloodstream. So anytime you need to do something more than normal, you need more blood flow, because inside the blood is what we need to make it work, okay? Now, going back to your sympathetic nervous system being speeded up, and let's take the car accident away. You have to give a presentation at work, okay? You have to give a speech at your son's wedding or something. You have to do something, right? And you're not good at public speaking. So you're nervous about it, and you stand up in front of the crowd, and you start feeling your heart rate increasing. So you feel a little pounding in your chest. You notice that you're breaking out in a cold sweat. And then all of a sudden your stomach starts making like strange feelings. Like you have they call it butterflies in your stomach. You feel like things are bouncing around. So what happened? Because you were scared, right, that you had to get up and speak in front of people, okay, adrenaline was released into your bloodstream. So what did adrenaline do? It increased your heart rate, okay? Why did it give you butterflies in your stomach? Because when this is activated, it takes blood from your digestive tract, because it's going to assume when you're scared, you don't have to eat. It's going to move it to more vital areas. Like we said, your arms, your legs, your brain, your heart, your lungs, and stuff like that. So when you don't get blood to your digestive tract, what's your digestive tract? It's your stomach and all the tubes that the food go through, all the intestine. So if you're not getting blood through those tubes, what do those tubes start doing? They start shaking. They start like twitching. And that's that feeling you get in your stomach of like, quote, butterflies in your stomach. Why does your skin break out in a cold sweat when you're scared? So you know that on the surface of your skin, right, you have thousands and thousands and thousands of little holes on your skin called pores, P-O-R-E-S. And the purpose of those pores is to give you the ability to sweat if you're warm, right? So if you get hot, little bits of fluid will leak out of those pores. And as air travels over that wet skin, it'll cool you, right? That's how it's called evaporation. That's how we cool ourselves. Every one of those little holes has a muscle that keeps it closed. Okay, so every one of those thousands of holes has a muscle. Okay, and 99.9% of the time, those muscles are closed unless you're hot. Okay, now you have adrenaline, okay, that got secreted into your bloodstream. What adrenaline does when it goes into your bloodstream is it denies blood to your skin and it denies blood to your stomach, to your digestive tract. So now all of a sudden your skin's not getting enough blood. So that muscle no longer has the ability to keep your pore closed. It relaxes. And when it relaxes, what do? You sweat, even though you're not hot, okay? Because the pore is open, fluid comes to the surface. Why is it a cold sweat? Because if there's no warm blood going to the surface of your skin gets cold, okay? So I'll just tell you, when we talk about patient assessment, it's never normal for somebody to have a cold sweat. Sweat should always be a warm sweat because you're trying to get rid of heat. So when people break out in a cold sweat, it means that their sympathetic nervous system was activated, and it means that something is wrong inside the body. Now, could it be that it broke out in a cold sweat because you have to give a speech? Yes. So you know there's no emergency, okay? Could it be cold because the person almost got into an accident and adrenaline was secreted in their bloodstream? Absolutely. So, but you have to figure out, is there a reason why, that I could explain why they broke out in this cold sweat? And if the answer is yes, then you know there's no emergency. But if they tell you, I just feel dizzy, my stomach's bothering me, I don't feel good, nothing happened, I'm not scared, and all of a sudden I broke out in this cold sweat, that's the body's way of telling you, okay, that um, that there is an emergency going on. So that cold sweat to us is a signal that we need to figure out what's going on, and more than likely that patient's going to the hospital, that we may not be able to figure out what's going on. Okay, somebody wrote, that's why when I'm nervous, I can't eat. Yes and no. I mean, if you're nervous, yes, probably because it's probably discomforting, or it's not so easy to process the food. But also when you're stressed, your appetite is the part of your brain that controls your desire to eat. When you're stressed, since you're more worried about whatever you're stressed about, you don't think to eat. So, so being stressed, actually, the only positive thing about being stressed is you're overweight, is that you tend not to want to eat, okay? Or you tend to eat poorly. Now, the other part of your autonomic nervous system is called your parasympathetic nervous system. And that's abbreviated feed or breed. Okay, so what does that mean? That this is activated when you're eating food or you're having sex. Okay, so your parasympathetic slows down the heart and breathing, and it causes vasodilation. Now, let's talk about it. You've experienced this. It's 2 o'clock in the afternoon on Shabbos. You just had a huge Suda, and you feel exhausted, right? You just feel like you have no energy, and all you want to do is take a nap. Okay. What happened was, because you have all this food in your body now, your digestive system has to process that food, has to push it through your digestive system. So now what it does is it calls for more blood to go to your digestive system. And that gives you the sensation of feeling tired, because there's other parts of your body that are not getting blood because it's going into your digestive system. For a man to get an erection, for their penis to get hard, you have to have vasodilation. So when you have sex, at some point your sympathetic nervous system speeds up, and at some parts, to get an erection, your parasympathetic nervous system speeds up to get an erection. So both parts work when you're having sexual intercourse. Okay. Now, when people accidentally stimulate their parasympathetic nervous system, like they see blood, they get bad news, they strain on the toilet, we call that a vasovagal response. This is something you're going to hear all the time once you get out in the field, that somebody vasovagaled. So vaso means blood vessels, and vagal means the nerve that activates this is called your vagus nerve. It's your 10th cranial nerve, and this is what activates this whole side of it over here, this parasympathetic side, from happening. When the vagus nerve is activated, it secretes a different chemical, not adrenaline or epinephrine. It's called acetylcholine. You don't need to know it. And what that does is it slows down the heart and it dilates the blood vessels. If I was straining to go to the toilet, and this has all happened to all of us, you're straining to go to the toilet and you feel dizzy. Okay. So what you're doing is that when you're straining, you're increasing the pressure in your chest and your neck. And somehow by doing that, we trick that nerve to secrete the chemical that caused the heart rate to slow down and the blood vessels to relax. And when the heart rate slows down and the blood vessels relax, our blood pressure drops. Okay. And because we're sitting up, we need a certain amount of blood flow to our brain to keep us awake. And when we accidentally stimulate this, we slow everything down and people tend to faint. Now, the term for fainting in medicine is called syncope. This is from the first night of class, right? So when somebody syncopizes, that means they faint. Okay. Now, if they fell off the toilet and did not injure themselves, and now they're laying flat on the floor, what's going to happen over the next 5 minutes? Everything's going to reverse itself, right? Because whatever they did, their straining stopped, their blood pressure is slowly going to go back to normal, their heart rate's going to start increasing, they'll start waking up, and they'll be fine. Okay. What we always have to do is examine someone who had a vasovagal reaction and syncopized to make sure there's no trauma from the fall. Okay. And if that's the case, and it's an isolated thing that's explainable, they tell you they were constipated, they were straining on the toilet, they tell you where they were at the getting their blood drawn, or they were watching their children had to get their blood drawn and they fainted. That's all explainable stuff. So if they didn't injure themselves, it's probably not a big emergency going on. Okay, so somebody said, so what's sweat? Sweat is a fluid, yes. Okay, so sweat, remember I said 60% of our weight is fluid. Out of that 60% of weight that's fluid, only about, I don't know, somewhere probably between 20-25% is blood. So where's all that extra fluid? So this is going to be a little hard to wrap your head around, but remember I said we have millions of cells? Well, every one of those little tiny cells that you can't see with your naked eye is filled with fluid, and all of those cells are floating in fluid. So it's almost as if you were to grab somebody's skin and squeeze it, that water should be like flowing out of their skin. We are, even though you see skin and you feel bone, and we're really just a blob of water that's contained under our skin. And that's why when you fast, okay, or when a kid gets dehydrated because they have diarrhea and they have vomiting and stuff like that, that they get so sick so quick. So we are just full of fluid, and we cannot tolerate not being, full of fluid. So the sweat is just a different form of fluid. Okay, it's more like, sweat is more like plasma, which is the fluid portion of blood. Okay, and sweat is there to cool you if your temperature starts to go above a normal temperature. Okay, and that process of cooling, when your pores open up on your skin and water goes onto the surface, and the cooler air travels over the water and removes it, is called evaporation. And remember, evaporation does not work well when the air itself is humid, right? So if you were in if it was 98 degrees outside and humid, you'd be sweating, but you would still feel warm, because when it's humid, it means the air itself is super saturated with moisture. So that process of evaporation doesn't work well. But the other hand, every morning when you get out of the shower, right, you feel cold because you have water on your skin, okay, and you have cooler air traveling over that water. So that's evaporation. So one of the easiest ways to lose temperature, to have a cold emergency, it's called hypothermia, is to be wet and have a little bit of a breeze, right? Nothing cools the body as quick as cool water and cool air. And that's why it's always dangerous when people go hiking and they don't have the right stuff and they get caught in the rain and the wind picks up and it starts to get dark. They can get hypothermic very, very quickly. Okay. Okay. So any questions? Well, I know there's tons of questions, but anything as far as sympathetic, parasympathetic. Remember, sympathetic, we said fight or flight, speeds things up. Okay. It's our emergency part of our nervous system. Parasympathetic is the brake to the sympathetic, and sometimes it can be activated accidentally. Okay. When somebody, like I said, gets bad news, sees blood, strains on the toilet, and stuff like that. Okay. So somebody wrote cold sweat, same. So is a cold sweat the same sweat as warm sweat? Yes. The difference is the temperature of your skin. So that when you're hot, your skin is hot, right? So the way it works, again, we're getting a little ahead of ourselves as far as, what we're doing, but the way we control temperature, okay, is by moving blood either to the surface of your skin, more blood to the surface of your skin, or keeping the blood deeper inside and not to the surface of your skin. So when you're hot, what it basically does is it pumps more blood, that hot blood, right? Because you're hot, that hot blood to the surface of your skin, so that when you have the evaporation occurring, okay, you cool yourself. So that's why when somebody's warm, their skin looks flushed, looks pink, looks very red, right? Because it's bringing more blood to the surface. When you're cold, your skin looks pale because it's keeping whatever warm blood you still have, keeping it deeper inside, okay? And then your skin gets pale. And again, the sweat that occurs is because you're not getting enough blood to the surface of your skin to keep the pores closed. So when you do sweat, when you're cold, it's not a way of losing heat. It's because those muscles that keep the pores closed are relaxing because they're not getting blood. And because your skin is cold, it's a cold sweat. Okay. The other thing that happens when you're cold that you've all experienced is that, I don't know how you say it in Yiddish, but goosebumps, right? They call it goosebumps. Your skin gets these little tiny bumps. So what it actually does is all those muscles start to tighten at the same time, and it actually makes your skin, instead of being smooth, look like it's got, ridges, like little mountains in it. And it does it for two reasons: to close your pores, and it also decreases how much what they call surface area of skin you have, right? If you start to tighten up the skin, there's less area to lose heat through. So now somebody says, how long till it gets back to normal? Are you talking vasovagal? So vasovagal really depends on, is the patient taking any medications that the medications themselves will lower blood pressure and slow heart rate. So it depends on their age. It depends on why it happened. But typically somebody who just has a non-emergency vasovagal, they accidentally did it to themselves, should start feeling better, within 5 to 15 minutes, they should really start feeling better. And the sign that they're feeling better is that their heart rate will approach normal and that they'll be able to sit up without feeling dizzy, right? That's the two signs that they're, but remember, before we ever sit them up, we want to make sure they had no injury from the fall, okay? This is a very busy slide just showing you where the different nerves go for the different bodies. Don't worry about it. We're not going to really, worry about that right now. Okay, so now off the nervous system, and again, we're going to review everything, so don't worry about it. We're going to switch on to the digestive system. It's 9 o'clock, so we'll take a break in a couple minutes, okay? So your digestive system, sometimes this is called the GI system, gastrointestinal system, is the system that processes food. And why do we have to process food? Because we need sugar, we need vitamins, we need water, we need nutrients, we need all the good stuff, okay, to make our body work. So when you put food in your mouth, okay, and you start chewing it and it mixes with the saliva in your mouth, digestion starts. And then when you swallow, remember your epiglottis closes over your airway, over your trachea, and the food goes into your food pipe, which is called your esophagus. And the minute food hits your esophagus, even though we call your esophagus a tube, it's actually a flat tube, okay? And as soon as food hits the esophagus starts squeezing and moving the food downward. So the esophagus actually contracts and moves the food down, and it goes into your stomach, and the upper part of your stomach has a very strong acid called hydrochloric acid, and that hydrochloric acid mixes with the food, okay, and starts to break it down further. It goes into the lower part of your stomach where there's a lot of good bacteria, okay, and that good bacteria also helps with the digestion of the food. And once it leaves your stomach, it's almost kind of like a mush, kind of almost looking like a poop, like stool, and it enters into your intestines, and in your intestines, all the nutrients are pulled out, okay? In your small intestine is the first part. It's only small because of the diameter of it, but it's very long, and it takes a while to go through it, okay? And all the good nutrients are pulled out. Now, when I say pulled out, where's it pulled out to? So we know those nutrients have to get into the bloodstream, right? Because the blood is what circulates everything. So just like you had capillaries touching your alveoli to get oxygen, you have capillaries touching every length of your intestine to pull the good stuff out of your intestine and transport it to the different parts of the body. And just like you had hemoglobin on the red blood cell for oxygen to transport on, you have a substance called insulin, okay, which is a hormone that the sugar attaches to and is transported in the body. So people that are diabetics, okay, have a problem with not having enough insulin, which is why they have a problem with controlling their sugar. Okay. So again, digestion starts with your food, with your mouth, by chewing food. It goes into your throat or your pharynx. Then it has to be shifted to the back tube, which is your esophagus. That's accomplished that when you swallow, your epiglottis closes over your airway. Food goes from your esophagus into your stomach, from your stomach into your intestine. It starts with your small intestine, then your large intestine. And by the time it empties out of your large intestine, it's basically stool or poops, what you're going to poop out. And from there, it's stored in a structure called your rectum until your rectum is full. That gives you the sensation that you have to go through to the bathroom, and then you push it out through another tube and it comes out of your body. Okay, so that's kind of how digestion works. Your stomach is the organ that's mainly in your left upper quadrant, and your intestines, because they're so long, run through all 4 quadrants. So if there's ever a test question that says what abdominal organ is in every quadrant of your abdomen, remember there's 4 quadrants, it's your intestine, right? So both your large and small intestine travel through all 4 quadrants. Somebody had a question?
What is the colon a part of the intestine or colon?
Yeah, so the colon is the term for the small intestine. So it's the same thing. Somebody has colitis or Crohn's disease. Okay, so that's basically
like a twist colon, a twist bowel.
So yeah, it's basically, so when you say the bracha after you go to the bathroom, and one of the things it says is that all the tubes should be straight and not twisted. So one of the miracles in your body is that you have, I forgot how many exact feet, but say like 20 feet of intestine, okay, and you got food traveling through it all the time, and it doesn't actually, for most people, there's never a problem. There's never a blockage. There's never a obstruction. There's never a problem. So yeah, it's more common for people to have those issues when they've had different types of abdominal surgery. That's where you get, intestine that gets blocked or intestine that gets twisted and stuff like that.
So I know somebody had a appendicitis, and after that, from the scar tissues,
Yep.
you got a twist bowel.
Yeah. So what happens with the scar tissues, you get something called adhesions, where instead of the intestines right now your intestines are floating freely in your abdomen, right? They're not tied to anything. They're, I mean, obviously they start at your stomach and they end at your rectum, but they're not actually anchored. They float around kind of a little bit. So when you have surgery and you get scar tissue, they get stuck. Certain parts of them get stuck to the wall of your intestine. And since they're not floating freely, it's more common for them to get, blockages and twists and stuff like that. So that's, definitely a side effect of having surgery, especially if the surgery was emergently and they couldn't take their time and be very, very careful and stuff like that. Okay, people ask two questions. Is hydrochloric acid what causes heartburn? Absolutely. So what happens is when your esophagus ties to your stomach, right? So the tube comes down, your food comes into your stomach. Right where your esophagus and your stomach meet, there's a valve, okay? It's called your lower esophageal sphincter. It's basically a valve that stays shut until it feels food. And when it feels food, it opens up and lets the food drop in the stomach. And the reason it's there is that the upper part of your stomach has a very strong lining that could survive this high acid, this hydrochloric acid, but your esophagus doesn't. And if that valve wasn't there and the acid was to come up through the valve, it would burn your esophagus and it would be extremely painful. And if you have this happen repeatedly, you could have a condition called erosions. Erosions mean like erode, like they eat away at the inside of the esophagus, and it raises your risk of two things. It raises your risk of esophageal cancer, which is cancer of the esophagus, and you could actually perforate the esophagus and have a hole in it, which is obviously a surgical emergency, right? You can't have a food tube that has a hole in it, and food is now going to, start to empty out into your stomach cavity and into your abdominal cavity and not your stomach. So that's the danger. So somebody who has repeated what they call GERD, G-E-R-D, gastroesophageal reflux disease, most of the times it can be managed with medications that you tend to, it causes you to secrete less acid. Okay, but in some cases, because that sphincter has become damaged, and they actually have to do surgery to repair that sphincter so it stays closed. If you've ever experienced late at night where you feel like there's something coming up in your throat and burning, that's because when you're laying flat in bed, it's easier for the acid, if you have a weak sphincter down there, it's easier for the acid to work its way through, especially if you had spicy food or a big meal right before you went to bed. Okay. And then it says, is the kidney also in 4 sections? The kidneys really are in the back of your 2 upper sections, I would think. Let me just think. Yeah, they would be in the back of your 2 upper sections, right? So they're in the posterior of your right upper and left upper quadrants. Again, remember, a lot of organs are in multiple quadrants, but they always say they're only in one, and they say it's the one where most of it is in. Like your liver, they call it a right upper quadrant organ, even though it crosses over into the left upper quadrant, because the vast majority of the liver is in the right upper quadrant. Okay. Colon, yes. So
In the
your
book,
intestine is in all
in the
4
book, it
quadrants.
says the kidney, where it shows the picture of the 4 quadrants. It says in all 4 quadrants, kidney. Like half is going down and half is standing to the top.
Right. So, but again, they're going to call them upper quadrants because the vast majority of them are in the upper quadrants. Okay. Okay. So, where were we? Okay, we'll take a break in a couple of minutes. Again, just showing you the organs. Actually, this is a good picture. I don't know how big it comes in your thing, but this is a good picture of the esophagus coming into the stomach. And you see how there's like a muscle or a valve here. So that's what I was talking about as far as the sphincter. So the food comes this way, but the upper part of your stomach is where the acid is. So it's preventing the acid from going back up. Okay. The lower part of your stomach doesn't have that lining, but it doesn't matter because the acid doesn't go down there. The lower part of your stomach to digest food by bacteria. And sometimes when you take antibiotics, especially the erythromycins, it kills your stomach. You get like cramping and pain and everything. Antibiotics are designed to kill bacteria, and they can't differentiate between the bacteria that's making you sick and the good bacteria of your stomach. So when you take erythromycin, it wipes out all the good bacteria in your stomach and it changes the chemistry of your stomach. So it's very important if you're on certain antibiotics, okay, that you eat good bacteria. So you could do that by eating yogurt or you could go to the health food store and get something called acidophilus that you add to water or milk or something and drink. It's basically the bacteria that you're repopulating your digestive tract with. So some people even just take it every day just to constantly add good bacteria to their digestive tract. So if you suffer with your stomach, that's one thing you would always want to consider, is that is there a problem with the chemistry or the mixture of the different bacterias that are in your stomach, and that could be what's causing the problem. Okay. Um, okay, so I just wrote basically, real quick where everything is. On the test, they'll always ask you a question. They're going to say, in what quadrant is the liver? What quadrant is the pancreas? What quadrant? They'll ask one. They typically ask the appendix, right? Because people have appendicitis, and the appendix is in your right lower quadrant. Interestingly, your appendix is a tiny little organ that has no function nowadays. They don't know why it's there anymore. One of the beliefs is that when people ate meat that may not have been fully cooked, that it had some kind of role. It may have been much bigger, thousands of years ago, who knows? But it's a little about the size of your pinky. It hangs off your intestine. And the problem is that sometimes food particles get stuck in it, it gets infected and inflamed, and it can cause a big infection in your entire body. So these, the locations of your organs, just you keep on looking at it, you'll eventually get it down. It'll be on tests. We'll be talking about it. Obviously, when we do trauma, we're going to be saying, what type of injury can somebody experience if they were hit in their left upper quadrant? What type of injury can they experience if they're hit in their right upper quadrant? So you'll hear the different organs being used. Okay. Okay, off your digestive system into your integumentary system. So this is a fancy way of saying your skin. Okay. So your skin has a couple functions, right? So the function is to protect the body, okay, from the outside environment. In other words, temperature, pollution, germs, okay, things that don't belong in your body. So your skin is your first line protection, okay? It regulates body temperature. We already explained, so I guess it was good that we did it before, okay? It regulates body temperature by either making you sweat, okay, and opening the pores, or by constricting the pores, okay, and keeping the skin closed so the cold air can't penetrate your skin. It regulates it by how much blood is going to the surface. If you want to get rid of heat, it lets more blood go to the surface, so you get rid of heat. And if you want to keep your warm blood, it keeps your skin deeper inside your body, not towards the surface. That's why you're pale. Your skin looks pale when you're cold, and it looks flushed when you're warm. Flushed is like that reddish sensation, like when people have a fever or they get embarrassed. Okay. Um, it has nerve endings that detect a lot of different things, right? Heat, cold, touch, pain, pressure, okay? And it aids in the regulation of controlling water and salt and stuff like that, again, by sweating or not sweating, right? So, it's plays a role in that. Not a huge role in it. Your kidneys play a much bigger role in regulation of water and electrolytes, but it plays somewhat of a role in it. So if you were to actually wrap your body in plastic, you'd last about a day, okay? Because you have to be able to have things leave through your skin, and if you wrap yourself in plastic, you would not be able to have that happen. Okay. Okay. When we talk about burns, when we talk about trauma and burns, we're going to classify burns by the level of the skin that's involved. So your outermost layer of skin that you see is called your epidermis. Epi means above, right? Remember epinephrine, epiglottis, I'm trying to think what else we had. Epidural, right? Epi means above. So epidermis means above the dermis, which is the next layer, okay? And the subcutaneous layer is the fatty layer. So you have a thin layer on the surface of your skin that's mainly composed of dead skin cells. That's why if you ever scratch your skin, it looks like it's kind of flaking up, okay? So your outermost layer is mainly dead skin cells held in place by some oil, okay? Then you have a thick layer called your dermis. That's where most of your blood vessels and your nerves and everything run through. And then you have an insulation to help you control heat, a fatty layer called your subcutaneous. Okay, so burns to the outermost layer of the skin are called superficial burns. Okay, burns that go through the epidermis and the dermis are called partial thickness. That's what you've usually seen. A sunburn would be a superficial burn where you have reddened skin on the surface. A blistered burn would be a partial thickness because it goes through multiple layers. And then a full thickness burn goes through all the layers. It may include the bone. Okay. Now, when you have a blister, what's trapped under the blister? What's that fluid, do you think, that's trapped under the blister? So some of you may say,
Plasma.
good, say it.
Plasma.
Very good. I was going to, some of you might say sweat, but you're right, it's plasma. Now, why would plasma be trapped under the blister? Because when the burn, okay, when the heat hit the skin, it obviously hit the capillaries. And what did it do? It damaged the wall of the capillary, and they leaked plasma, and the plasma got trapped under the skin and made a bubble. That same plasma, when you have a blister on your foot because you have badly fitted shoes, it's the same plasma that's under that blister also, okay? There, it's a different reason. What did you do to the capillary? From the rubbing of the shoe on the skin, you damaged the wall of the capillary and it leaked, okay? So whenever you see a bump on the skin, it's usually plasma. If the bump is more like a bruise, a contusion, where it's get a red color, that means you actually broke the capillary, like if you were punched and you got a bruise. And then not only the fluid portion of blood leaked out, but because you broke the capillary, the red blood cells and the white blood cells and the platelets leaked out too, and that's why it gets a different color. But a straight capillary leak, the fluid is pretty much clear, right? Because plasma itself is pretty much clear. How many people have heard the term hives?
Plasma is not yellowish.
It's got a slight yellowish discolorization to it, but it's really, it's, you know, I mean, if you looked at pure water and plasma, you would say plasma looks a little yellow, yes.
But if you see just plasma, it looks clear.
I'm sorry?
If you see just plasma, it looks clear.
It does, yeah, I mean, in other words, when you compare it to just straight water, I would say, yes, you'd notice it's a little yellow. And if you have really good eyes, maybe you'd say it looks a little bit yellow to you, okay? Okay, so somebody's saying my voice is not clear. So is it better now? Is my voice okay now?
You're good.
Okay. Okay, so let's go through. I missed a whole bunch of questions here. So is the colon, is your intestine in all four parts of your quadrant? Yes. Dermis looks like ghosts. Oi. Okay. Okay, I don't know what that one is, but okay. Not so clear, 5x4 your voice. Okay, so we fixed that. Is plasma not red blood? No, plasma is the fluid portion, right? So inside your blood vessels is the water, is the plasma, and then floating in the plasma are the three types of cells: the red blood cells, the white blood cells, and the platelets, right? So the plasma is the fluid that everything else floats in. And obviously, when red blood cells are exposed to oxygen, the blood gets a reddish color to it because the red blood cells color the plasma, you know, reddish. But if you were to look at blood flowing through your blood vessels without being exposed to outside oxygen, they would kind of look more, you know, wouldn't look as red as it does when you're cut. Like when you're cut, the reason it gets so bright red is that blood has been exposed to the outside oxygen, you know, in the room. So that's why it gets so red. Okay, so going back to the skin again, we said that we had multiple layers. The outermost layer is your epidermis, next layer is your dermis, and the fatty layer underneath is your subcutaneous. You need all three layers. Obviously, you don't need to have a lot of fat, okay? Especially in, you know, parts of your body where it's not good for you, on your liver and on your stomach and stuff like that. But you do need some fat to act as insulation so that you can control your body temperature. Okay, so again, just showing you the same thing, okay, you know, just different ways. So your epidermis here, okay, underneath your dermis, and then you have your fatty subcutaneous layer, and most of your important stuff, okay, is deeper down.
In burns, it's called like first, second, and third degree.
So that's the old way. Burns used to be first degree, so a first degree is superficial, a second degree is partial, and a third degree is full thickness. So it's just somebody got paid to think of a new way of classifying it. So in a test, they don't use first, second, and third. Sometimes if they're really nice, they'll write superficial and in parentheses write first degree. And then sometimes if they're not very nice, they'll just use superficial. So, but we'll go over that. But yes, you're right. The old way was first, second, and third degree. Okay, so now another system. It's a 9:20. At 9:30, we'll take a break. Your endocrine system. So people who have problems. Now there's many different endocrines. Endocrines are chemicals or hormones that do things in your body. So the two classic hormones that we talk about, okay, in the body would be adrenaline, okay, which speeds things up, and insulin, which is the transport mechanism for sugar. okay? But there's a lot of other different hormones in your body. But again, on an EMT level, we don't really talk about it. So your pancreas makes it insulin, and insulin is what sugar binds onto. So when you eat food, the food crosses over from your stomach, from your intestine into your bloodstream, and it gets onto insulin, and insulin is the only thing that the cells will let travel, bring the sugar into the walls of the cell. So picture every cell has a wall with a door on it, and that door is closed to everything unless the cell decides to let it in. And the only way it lets oxygen in is if hemoglobin knocks on the door. And the only way that it lets sugar in is if I'm sorry, the only way it lets oxygen is if hemoglobin knocks on the door, and the only way it lets sugar in is if insulin. So you could be breathing perfectly, but if you don't have enough hemoglobin, your cells will die. You could be eating a ton of food, but if you don't have enough insulin, the sugar will not get into the cells. Okay, so you need both of those hormones. So again, pancreas makes pancreas makes insulin, and the adrenal glands, which are two little tiny structures on top of your kidneys, make the epinephrine. Okay, they actually make two chemicals, epinephrine and norepinephrine, but whatever, for now we'll say epinephrine or adrenaline. Okay, so epinephrine, which is we call a layperson is adrenaline, and norepinephrine are the two hormones that speed things up, and they're made by the adrenal glands, and they are the chemical of the sympathetic nervous system, right? So remember I said the sympathetic is the fight or flight. It's what speeds things up, right? That's your emergency part of your autonomic nervous system, okay? Okay, so let's take a break right here, and we will come back in a couple minutes, okay? And then I'll answer some of these questions that people put up, okay? So everybody take a break for a couple of minutes, and then we'll be back. It's 9:22, so just take a couple minutes. I'll be back by 9:30, okay? Anybody have any questions?
I'll hotspot my computer.
What's that?
You were talking earlier about the intercostal muscles. I saw the picture you gave out. There's the internal intercostal muscle and the external. There's two intercostal muscles?
There's two sets, right? So between each rib, so so you have rib going, well, hold on a second here. You have ribs going all the way down. So between each rib is the internal intercostals, and then running from like the top to the bottom on the outside of the ribs is called the externals, and they both play a role in changing the diameter of your breathing. But they're not going to ask you on the exam, is there an internal, external, or anything like that. They're just going to say what two muscles are the muscles that change the shape of the chest to make breathing occur, and those are the intercostals and the diaphragm. And if they ask you which one plays a bigger role, it would be the diaphragm. Like it's like something like 80% diaphragm, 20% intercostals.
Okay, and then one more question. And the intestines, so you earlier said it's in all the four quadrants. But I see here that it, on picture you gave out that says the small one is in all four. So where's the big ones? Where's the small ones?
So off your stomach comes your small. It snakes all the way around, I think like once or twice through all four quadrants. And then it connects to your big one. Your big one is bigger only because it's wider. It's not as long, okay? And then that ends on your rectum where you go to the bathroom. So it's like one continuous tube, except that, one is of a bigger, longer and of smaller diameter. That's your small intestine. And one is of bigger diameter and not as long. And that's your large intestine. They're not going to necessarily ask you any of those types of questions. I got to be honest with you. Even on a paramedic level, there's not much we can do for problems with the digestive system, right? I mean, it's basically taking them to the hospital. There's just not anything in an emergency level we could really do for those patients. Okay, somebody asked, are the yellow circles fat? I assume you're talking about on the slide. So let's go back. Yes, they were. So I think over here. So yes, that's all supposed to be fat over here, right? And this fat is supposed to be good fat, which acts as a insulation. Okay, can we get a break for a few minutes? Yes. Is there class next Tuesday? Yes. The only thing next Tuesday is I'm teaching at 5 o'clock to some doctors. I should be ready to go by 8, but if for some reason I'm not, I will text on WhatsApp and let you know if I'm going to be a couple of minutes late. Okay, do all hormones travel through bloodstream? Good question. So no. Some hormones actually have, from the organ that makes them, they actually have ducts that go directly to where they need to work, and some of them are dumped into the bloodstream. So some of them have tubes that bring them right to where they need to go themselves, and some of them, like your gallbladder, right, and some things have actual, tubes that bring what they need to bring exactly where they are, and some are dumped into your bloodstream. Most hormones are dumped into your bloodstream, but too many things in a very short time. I agree with you. What part of the body produces acetylcholine? Your brain. Okay. You don't need to know acetylcholine.
How do you do blood pressure when they have dialysis or?
So you may not be able to be honest with you. If you can't get to either one of their arms, you're probably just better off transporting them. But it is technically.
Paramedic hasn't any way of doing that?
Nope. So a lot of times if we really, really have to, if somebody's like too fat to get a blood pressure cuff on their arm, or they have reasons why we can't put a blood pressure cuff on their arm, you could put it on their lower arm and then feel for a pulse. So you don't get the systolic and diastolic, you only get the systolic number. And again, you don't, right now you don't understand all that, but so there's ways we could modify it. But I would say, out of the 30-something years I'm doing this, there's maybe 5 or 6 times where I wasn't able to take a blood pressure on someone. So it's not a real big deal. Okay. So somebody wrote, what causes a stroke? I guess they mean what causes a stroke. So there's 2 ways you have stroke. So stroke is basically a heart attack in the brain, right? A heart attack is a problem with blood flow in the coronary arteries, that are arteries on the surface of the heart. A stroke is a problem with the cerebral arteries, which are the arteries that give the brain the blood it needs to stay alive. So there's 2 types of strokes. There's what they call a blockage stroke, where they have a clot. And then there's another one where the patient has an aneurysm or a weakened part of the artery and it bursts. So those are the 2 ways that people have strokes. Okay, and we're going to spend, a night talking about all different problems and stuff like that with strokes. Okay, so let's finish up, what we have for tonight. And then what I would say is, please finish reading the chapter on anatomy and physiology. And then next Tuesday night, we're going to do a review. And we're going to talk a little bit about the next chapter, which is physiology, like pathophysiology, disease process. So I believe that's chapter 7. I actually don't have, somebody borrowed my textbook, and I don't actually have the textbook to look at what chapters are which. I was going to try to make you a reading list, but I'll get one from David or Yankee or something like that. So just keep on reading. If you haven't read chapter 6, read it. If you've read chapter 6, go on to chapter 7.
I can borrow your mind if you need.
I want you to read yours. So, okay, so let's go on now. We did endocrine. Okay, so we're up to the renal system. So the renal system is your kidneys. Okay, and again, the purpose of your kidneys is to filter and clean the poisons out of your blood, right? And people who have renal failure are the patients we said have to have dialysis, okay, which is an artificial machine that their blood vessels are hooked up to, so that just like the kidneys clean the blood because the blood travels through the kidneys, now since their kidneys don't work, they cannulate or they connect their blood vessels to a machine, and they stay on that machine for hours, sometimes 4 to 8 hours, and they run their blood through the machine to clean it, and they usually have to do it every other day, okay? So what does your renal system do? It cleans, filters, cleaning, okay? It regulates the amount of fluid. So if you had too much, if you drank a ton of water, your kidneys would actually sense you have too much fluid in your body and cause you to urinate, okay? And pH is the measurement of the amount of acid versus the amount of base in your body. I think we talked about this briefly when we talked about like people who maintain pools and stuff like that. So your body you have to adjust your pH balance in your body, just like you have to adjust the pH balance in a pool. But again, that's something that happens involuntary in the body. And the way it basically does is, I think everybody knows baking soda, right? So baking soda is what we call a very neutral or basic thing, and it neutralizes acids. So we have baking soda in our body, and if our body gets too acidic, that baking soda, flows to kind of neutralize it, okay? And the kidneys kind of control all of that. So the main part of your renal system are your kidneys. You have two kidneys, okay? And let me just see if somebody had something. No. So you have 2 kidneys, okay? And they're both in your upper quadrants mainly, right and left, but all the way to the back, Okay, that's when somebody has like a kidney stone, they have back pain, not front pain. Okay, so once the kidneys filter the fluid, they're going to transport the waste products of that filtering. In other words, they filtered the blood, they took out all the bad stuff, and they're going to transport that bad stuff to a holding organ called your bladder. So it's basically a reservoir or a kind of a tank that you hold your urine in until it's filled enough, stretched enough that it gives the brain a signal that you need to go to the bathroom. Okay. Now, there's two sets of tubes. They're not going to ask this, but there's two sets of tubes that sound alike. So urethras over here are the ones that go from your bladder to your kidneys, and urethra are the one that goes from your bladder outside your body. So in us, it goes from your bladder to your penis. So if you look over here, right, so here's your two kidneys, okay? They're filtering the blood that goes through them and putting back into the blood clean blood, right? Nice filtered blood. And the waste products are going down these tubes, so the urethras, right, to your bladder. Your bladder basically is almost at the bottom of your stomach, like right at the bottom by your pelvis there, okay, which is basically just a bag, like a chamber to hold the urine. And when there's enough urine in there, it stretches, and there's nerves that sense that stretch that then tell you you have to go to the bathroom, okay? And then you push that fluid out another tube that in men go out their penis, right? And then the urine leaves their body. Okay, so that's basically how the urinary system works. When we talk about abdominal emergencies and stuff like that, like we talk a little bit about kidney stones, the people, because obviously we get calls for people. So kidney stones are that some people eat foods that have a lot of minerals in them. Minerals are like substances that are hard, okay, and they build up in their kidneys. Sometimes they turn into almost a little pebble, a little rock. And obviously, as they're traveling on their way out, it becomes very painful because they're scratching all the way through this tube trying to get out, and the pain is excruciating. Some people have terrible, terrible pain, and they actually feel the pain traveling through their body, and then sometimes the stone actually gets lodged, and they have to have a procedure where they send sound waves to bang up against the body to break it, and it's very excruciating. And if it doesn't free up on its own, they sometimes have to have surgery. Now we'll end up with the reproductive system, okay, which is how we make children, how we make babies. And obviously we're most concerned with the female reproductive system. Men typically do not have problems with their reproductive systems. So the main organ of a woman, and we're going to do a whole night at least, if not 2 nights of delivering babies and talking about all this, but just to introduce it tonight, just in case any of you have wives that are having babies, when the doctor starts talking to you, you'll understand a little bit about what we're talking about. So the women have a structure called the uterus, right up here, the uterus, which is basically a structure when they're not pregnant about the size of their fist. Okay, that's how big it is when they're not pregnant, and it expands to the size of the baby when they are pregnant. Okay, and all it is a muscle to push the baby out. Okay, that's all it really is. Okay, it's a very thick muscle that has the ability to hold on to the baby for 9 months, and then when the time comes, it starts to contract and pushes the baby out. Okay, so the top of the uterus is called the fundus, and the bottom of the uterus is called the cervix. So when the doctor, the obstetrician, is checking to see how dilated and the woman is, they're looking to see that how much this opening has widened to allow the baby to actually deliver, right? So until the baby's ready to deliver, it's closed. And then as it gets closer to time for delivery, the opening starts to widen. That's called, when they say they became more dilated, okay? Now, how does the whole thing happen? A woman has 2 structures called ovaries that produce eggs, okay? And once a month, a woman ovulates and releases an egg, usually 1 egg from each ovary, okay? The eggs are stored inside the ovary, and once a month, one comes to the surface. It actually tunnels its way out of the ovary and bursts through, so that every woman every month actually has a little tiny pain when she ovulates. It's called Mittelschmerz, pain in the middle of the month, middle of the cycle, okay? It was the first Yiddish word I learned, right, back in 25, 30 years ago, Mittelschmerz. As some women feel it, some people don't feel it. Now, the other thing that could happen is since the egg left a tiny little hole, there's a possibility for an infection, a cyst to develop. So there are some women who have ovarian cysts where they get infections in those holes, and it happens a lot of times frequently to them, where they'll get chills and fevers and infections and stuff like that. So they usually know what it is, and they're actually telling you what the problem is, and they may need to go to the hospital to get IV antibiotics and stuff like that. So if everything went according to plan, this woman would ovulate, the egg would be released, and right alongside each egg is a tube called the fallopian tube on each side. Now, it's making it look like that the fallopian tube is anchored to the ovary, and believe it or not, it's not. The ovary is anchored to the uterus by a ligament that holds it in place, but this is both this and the fallopian tube are moving a little bit. And what actually happens is that the fallopian tube has these finger-like little projections that are off, right at the end of it, and they're close to the ovary, but not right on it, and they're constantly going like this. And when the egg is released, they're supposed to grab it and sweep it up into the fallopian tube, okay? And that happens most of the times with no problem, right? That's why women are able to have babies. So the first thing a woman has to do is ovulate. The egg has to come out, and it has to go in the fallopian tube. We're going to assume that it's a good egg. It's capable of being fertilized, okay? It's capable of growing into a baby. So, we can't talk about like problems women have that they produce eggs and they're not good eggs, because, sometimes the eggs are good, sometimes they're not. Okay, but anyway, a woman ovulates, the egg comes up into the uterus, up into the fallopian tube, okay? Now, the fallopian tube kind of does what the esophagus does, is that once it senses the egg in there, it starts to squeeze and move the egg along the fallopian tube towards the uterus. But for a woman to get pregnant, what has to happen is after she ovulates and while the egg is still in the tube, and it takes a few days to travel from the ovary through the tube, the woman has to have sex. Okay, so if a woman had sex and the man's penis entered the vagina and semen was injected, right, shot out of the penis, it would swim up, okay, the vagina up into the uterus, swim into the uterus, and then swim into the fallopian tube and meet the egg. And if the sperm meets the egg, the sperm will actually pierce through the wall of the egg, and the egg will start to divide and become the baby. The cells will start growing and spinning, and it basically starts to divide. It has to continue to travel before it gets very big and fall into the uterus and implant in the wall of the uterus and start to grow and become a baby, okay? And it's going to develop everything you need to make a baby. There's going to be a placenta, which is the organ that develops to nourish the baby. It's going to be the baby. It's going to be the amniotic sac. It's going to be an umbilical cord. Everything you need is contained in that egg. It just requires the sperm to meet it and start the process, okay? Now, what could go wrong? So when we talk about obstetrical emergencies, it could be that the egg gets fertilized in the fallopian tube like it should, okay? But the egg gets stuck, and now it starts to grow in the fallopian tube too big, and it could burst the tube, and that's called an ectopic pregnancy, okay? And that's a true emergency, and a woman would obviously have a lot of pain with that. And the problem is that if it bursts the tube, running along the tube is a fallopian artery and a fallopian vein to nourish the fallopian tube. And if it bursts the tube, it bursts the artery and the vein, and a woman could bleed to death. Okay, so that's one problem that could happen. Another problem could happen is that when it falls into the uterus, it doesn't lodge or implant properly. And let's say that instead of implanting on the sides where it should, it implants right over here, and it starts to grow right over here. Well, now it's going to block the path that the baby has to travel through. So that's a different emergency, right? It's called placenta previa. What happens maybe if the lady was laying flat when the egg fell in and it lodges over here? Now every time she walks, the egg's kind of bouncing around, right? And the placenta is kind of bouncing around. So that's another emergency. There could be placenta, abruptio placenta. So there's all these different emergencies that could occur that we'll talk about, and we'll talk about the different signs and symptoms. But just how it works, right, is that a woman ovulates, okay, the egg is released, it starts to travel into the fallopian tube. If she has sex and sperm was ejaculated, up into the vagina, it travels up into the uterus, it meets the egg, and fertilization takes place. If that doesn't happen, okay, when a woman ovulates, the other thing that happens to the wall of the uterus is instead of being a nice, smooth, tough muscle, it gets actually mushy, okay, and soft, almost like a sponge, so that when the egg comes to fall into the uterus, it has a place to land into and attach and grow. If the woman doesn't actually produce an egg and it doesn't actually fertilize, then she can't get pregnant. So what happens is after a few days, when the body senses that there was no egg and there was no pregnancy, that lining, okay, that got nice and thick and fluffy, is not needed anymore, and it falls off and comes out as a bloody mass, and that's when a woman has her period. Okay, so that's what happens every month. So that's kind of, you know, like in a 5-minute review of how a woman gets pregnant or how she doesn't get pregnant. Okay, and that's kind of the female reproductive system, kind of in a nutshell. Okay. A man obviously has a reproductive system. So we have organs that produce the sperm that are called testes. And some people can actually have problems where the tube that brings the sperm from the testes to the penis, okay, gets twisted. So it's called a torsion, a twist, very, very painful. Okay. And, you know, it is I wouldn't say it's a life-threatening emergency, but it's definitely an emergency as far as the testes being deprived of blood and being damaged to a point where somebody may not be able to produce sperm, you know, that's good to be able to get a woman pregnant with. Okay. I've never had a patient with that. It can even happen in young boys. The smaller the testes, the more they travel around. So the more they're likely to get twisted. And then obviously the penis is the organ that penetrates the woman to have sex. I mean, technically, when a man has an erection, penis could fracture if, you know, they're overly aggressive with having sex and they're not going in the right spot and they, you know, bang against something hard. You technically could have a fracture. I've never had a patient with that, but, you know, it is possible, and that would obviously also be an emergency. But that's basically what happens with reproductive. So let's do a little review. Okay. So why did we suffer for the last 3 nights? Okay. To know all this. So part of it is so that when you're treating patients, you have a better understanding of how the body works. Okay. The other part is that you're going to be working with other people who have higher medical training, who expect that you understand how the body works. And then the last thing is that, you know, there are EMTs who just do stuff because I'm going to tell you that if the oxygen is low, you put the patient on the oxygen and you're happy with that. And then there's other EMTs who say, I really want to understand why I'm doing what I'm doing. You know, I just don't want to do it because you told me to do it. I want to understand why I'm doing it. And the way you understand how you treat a patient is by understanding how the body works, so that when it's not working properly, you can figure out what's wrong with them and then understand what to do, right? So there's like you know, the person who knows something to do something because there's a cookbook that tells them to do it, and there's a person who knows how to do it because they truly understand, you know, how to cook food and do stuff. So, you know, there's different EMTs, you know, and some EMTs are fine with just saying, okay, if the patient's pulse ox is below 96%, Frank said put them on oxygen, and that's what I do. I don't know why I'm doing it, but Frank told me to do it, so I do it. And there's other people, and I think it's a lot of you, judging from the questions you're asking, okay, that, you know, want to understand how the body's working. So that's kind of why we're suffering through this at the beginning of the class. And we do it at the beginning of the class because by the end of class, you just want to be done with it. Then we had different systems we went through. So that we started with the musculoskeletal system, which was muscles and bones. And we said the purpose of the musculoskeletal system was to give the body shape, to give the body protection, and to allow the body to make movement. And that movement is called locomotion, like locomotive. Okay. And also that the bones produce red blood cells, right? We said that was one of the other functions of it. Okay. And that we move basically as a voluntary thing where the brain tells certain muscles to contract because we want to move, and those muscles pull on certain bones and they make us move. Okay. And we said we had different types of muscles. We had smooth muscle, which is involuntary muscle. That's found in your lungs, your airway passageways, your blood vessels, your digestive tract, and that we don't have to tell those muscles to do anything because those are involuntary muscles. The brain kind of controls it. Then we had skeletal muscle that was voluntary muscle that we control by movement. And then there was the cardiac muscle or myocardial muscle, heart muscle, that was a special form. And the thing that's special about that is that the heart can initiate its own impulse to contract, right? And then we had the respiratory system that we said starts with your mouth and your nose. We talked about how it's better to breathe through your nose because it warms, filters, and moisturizes the air. We said that from your mouth and nose, it goes into your throat, and the term for the throat was the pharynx. Okay, and we had different levels of the pharynx. Where the pharynx meets the trachea, we had a structure called the glottis, and the top of the glottis is called the epiglottis, and that's the flap that when we swallow closes off the opening to our trachea so that the food or water that we're swallowing goes into our esophagus or our food tube. and the air would go into our trachea. Our trachea goes down a couple inches and bifurcates or splits into your right and left main stem bronchus. They go to your right and left lung. And once they enter into the lung, they split into smaller and smaller tubes called bronchioles. And at the very ends of each of the small tubes, and those tubes are so small, they're about the diameter of a hair. Okay, they end on sacs that look like grapes, right? Like grapes hanging from a vine. And those are called your alveoli. Those alveoli are paper thin, and wrapped around the alveoli are the pulmonary capillaries, and that the air can diffuse and the carbon dioxide can diffuse or transfer between the alveoli and the capillaries, and that's how oxygen gets into the bloodstream and carbon dioxide leaves the bloodstream to be exhaled from the body. We said that our drive to breathe is basically the brain monitoring the level of carbon dioxide. And if the carbon dioxide goes high, we breathe more and deeper, faster and deeper. And if the carbon dioxide level is low, we slow down our breathing. And that the main muscles of breathing are your diaphragm and your intercostals. And the way we breathe is that when we need to breathe, it tells those muscles to contract, which pulls our rib cage outward, makes our diaphragm go down. So when it pulls our chest out, it expands our lungs and it makes the pressure inside the lungs less than the pressure in the room. And then since the pressure is higher in the room and less inside your chest, the air flows in. It equalizes the pressure, then your muscles relax. The pressure inside your chest becomes higher than the pressure outside, and you exhale. Okay, so that's kind of how the respiratory system works. The cardiovascular system, we said, is made up of three things: the pump, which is the heart. The heart had four chambers. The upper chambers are atriums. The lower chambers are ventricles. In between the chambers are valves that only allow blood to go one way. We said that the right side of the heart pumps to the lungs. We need to know the right side is the pulmonary circulation side, and the left side pumps to the body. So that's the systemic, or it's the system circulation. So the right ventricle pumps to the lungs. The right atrium pumps to the right ventricle. The right ventricle pumps to the lungs. The lungs bring blood back to the left atrium. It goes to the left ventricle. The left ventricle pumps into the aorta, which is the biggest blood vessel, the biggest artery, okay, and that takes the blood to all the rest of the parts of the body. And then obviously the aorta splits into smaller and smaller arteries, okay, eventually ending in tiny arteries called arterioles. Those arterioles then turn into capillaries. And capillaries are not just one blood vessel, but they're a whole, looks like a spider web of blood vessels servicing your entire body, okay? And as the blood goes through the capillaries, the good stuff leaves the bloodstream and gets into the cells, and the stuff that the cells have used up already leaves the cells and gets into the bloodstream to come back and travel to whatever parts of the body are going to get rid of it. And then after the blood goes to the capillaries, it goes into small veins called venules, into bigger veins, eventually making it all the way back to the right side of the heart. And the two biggest veins are the inferior and superior vena cava, and the biggest artery is the aorta. Trying to think what else we would talk about as far as that.
Where does the pacemaker come into place?
That's what's going to tell the heart when to beat. So we'll get to that in a second. What was I just going to say? Oh, on the test, just remember, it says that arteries bring blood away from the heart, okay, and it tends to be high in oxygen. And the only artery that's not high in oxygen is the pulmonary artery that starts on the right ventricle. And then the reason it's not high in oxygen is it's pumping blood from the right side of the heart. And the blood on the right side of the heart is the old blood coming back into the heart to get pumped to the lungs to get fresh oxygen. And that the only vein that's going to be high in oxygen, because veins are always bringing blood back to the heart, therefore they're low in oxygen, is the pulmonary vein. We said that bleeding from an artery tends to be bright red and spurting as far as the test goes. Bleeding from a vein tends to be maroon or like a purplish red color, and it tends to be free flowing. And bleeding from a capillary tends to be red and oozing, they say, where it kind of drips to the surface, so to speak. What else do we have to say? So that's the heart. The heart, we said, has a pacemaker's system built into it to control the beating of the heart, and that the dominant pacemaker is called the sinoatrial or SA node. It's high up in the right atrium. It's set for 60 to 80 beats per minute. If that fails, we have another one in the lower down in the right atrium called the AV, atrioventricular, between the atrium and the ventricles, the AV node, set for 40 to 60. And if that were to fail, the ventricles themselves could beat at a rate of 20 to 40 beats per minute. What else do we say? So besides the pump, Then we have the fluid, right? So you have blood. You have about 6 liters of blood. Okay, so this is 500 milliliters, which is half of a liter. So you have 12, equivalent of 12 bottles of water, this size bottles of water in your entire bloodstream. Okay, and that the blood is made up of 4 parts. The fluid portion is called plasma, and that is what the other parts float in. So the other parts of blood are red blood cells, white blood cells, and platelets. The red blood cells have a special protein called hemoglobin, which is the only thing that could transport oxygen through the body. Okay, so the oxygen gets onto the hemoglobin, and the hemoglobin is able to enter the cell and give the cell the oxygen it needs. It has white blood cells that, for an EMT level, we say play a role in infection control, and it has platelets that play a role in bleeding control, or making a clot to stop bleeding. And then we have the tubes, which were the arteries, veins, and capillaries. So we had a pump, tubes, and blood, right? So that's your cardiovascular system. And obviously the role of the cardiovascular system is to transport blood that contains, whether it be sugar, whether it be oxygen, whether it be minerals, whether it be vitamins, to the cells of the body. And when that happens, that's called perfusion. And to remove the waste products, right? So perfusion is the feeding of the cells and the removal of the garbage from the cells, okay? And if we don't have good perfusion, that's called hypoperfusion or shock, right? And there's many different reasons that we're going to talk about. We're going to spend nights on talking about that, okay? Why somebody, may not be perfusing their cells the right way. And that once the cells get that food, they have to burn it to make energy. And the burning of the food to make energy is called metabolism. And the good metabolism is called aerobic, A-E-R, aerobic metabolism. And that is the burning of sugar with oxygen to make energy. And the reason it's good is that we can make a lot of energy. And the waste products are carbon dioxide and water, which are easy to get rid of the body. And that if we don't have enough oxygen to make energy, we revert from aerobic metabolism to anaerobic metabolism. We still make energy, just not as much. And the problem there is that the waste product is called lactic acid, and it's very hard for the body to get rid of it. And that was when I was talking about people when they were walking too fast and got a pain in their side, or where they were working with their arms over their head and they got shaky and tired. That's because you weren't getting enough blood to a certain part of your body, and that certain part of the body was not having aerobic metabolism anymore, was having anaerobic metabolism. We talked about the nervous. Good. Questions?
Going back to the heart,
Mhm.
when the pacemaker stops working, it's going falls down to the lower one, which beats like 40 to
60.
60.
Mhm.
And then when that stops, it's going down to its own, which is about 20 to 40,
To the
right?
ventricles, right. Mhm.
Right. Now, are you going to be able to feel that by taking a pulse and the
Yes.
weakness or just in the rhythm?
Uh,
Are you going to feel like it's going to be weaker,
Yes,
pulse?
it's going to be slower and weaker. Absolutely, very good. So if you go to somebody, okay, and they're not in great shape, they're not in great athletic shape, right? So remember, somebody who exercises every day, the heart doesn't have to work as hard to keep the body perfused. So if you were to all of a sudden start dieting and exercising and walking and running and and getting in good shape, your heart rate would start slowing down, okay, and your blood pressure would start lowering because it's easier for your heart to keep your body perfused. But let's say you go to somebody who just looks like we do, that we're not in great shape, okay, and you find they have a heart rate, instead of say 80 to 100 beats per minute, they have a heart rate of 40, and they're complaining of feeling weak and dizzy. So you would have to say the reason they're feeling weak and dizzy is their slow heart rate until proven otherwise. And besides checking their heart rate, the number of times it beats per minute, like you said correctly, is you'd want to feel when you feel their pulse. Is it very easy to find? Is it hard to find? And the other thing you want to check is their blood pressure. Do they have a normal blood pressure or low blood pressure? So if your heart is beating slower and weaker, you would expect the blood pressure to drop because it's not pushing. Remember, the pump is not working the way it should, so the pressure has to be less. Okay, it says, what do we see as a greenish color where veins close to the surface? So when you see, it's kind of a bluish color more than a greenish to me, but when you see the veins close to the surface and they look kind of bluish, maybe greenish, that's just because there's not oxygen in veins, right? The oxygen in veins is very low, so there's not a reddish color. When hemoglobin is exposed to oxygen, when iron is exposed to oxygen, it gets a reddish color, okay? So that's the reason why. Now, if you were to cut a vein and the blood was to leak out of the vein onto your skin, it would immediately turn red. Why? Because there's plenty of oxygen in the air, and it kind of turns red. Okay, so okay, so where were we? So we talked about respiratory, cardiovascular, nervous system. We said the central nervous system makes up your brain and spinal cord, and your brain is your master computer of the body, and it pretty much controls everything except telling your heart to beat on a regular rhythm, right? Your heart can beat on its own. Your brain can slightly alter that, but it pretty much the heart beats on its own. So it sends those signals out of the brain to the main wire, right? If your brain's the server, the spinal cord is the main wire that's going to send those signals from the brain and send signals to the brain. And that at every level of the 33 vertebrae, there's nerves that come off of it and go to all different parts of your body. Okay, and we said that as far as the brain goes, the part of the brain we want to remember is the medulla oblongata, or the brainstem, and that the reason we want to remember that is the control of breathing and the control of the diameter of your blood vessels, which is an involuntary function. We don't have to be awake to think about that, is controlled in your brainstem or your medulla. Okay, and that besides your central nervous system, which was your brain and your spinal cord, you had a peripheral nervous system. Okay, and that had two divisions, the voluntary and involuntary divisions. The voluntary was a series of sensory nerves that send signals to your brain. And the main senses, again, were your sense of vision, your smell, your taste, your hearing, and your touch. And remember, touch is not just your hands, but every part of your skin. Okay, so those send signals about different things to your brain. Your brain processes it and sends, those are sensory nerves that bring it into your brain. And then they send, if your brain wants you to do something about it, they send signals via motor nerves, okay, back out to the different parts of your body to tell it to move or do something. Okay. And then you had the involuntary part of your peripheral nervous system that was called your autonomic or automatic nervous system. Okay, and that's the one that runs on its own. You don't need to be awake. And that had two divisions, the speed up one and the slow down one. The speed up one was your sympathetic, and that's also abbreviated your fight or flight. And it had your slow down one, which is your parasympathetic, and that's your feed or breed. And that when your sympathetic is activated, it's because of a perceived emergency, a real emergency or a perceived emergency. And it secretes a hormone called adrenaline or epinephrine into your bloodstream that causes everything to speed up. Okay. And that after that happens, if the emergency is done, the parasympathetic is activated to act as the brake and slow everything down. And that sometimes we could accidentally activate the parasympathetic nervous system, and that's called a vasovagal response. And that could be accidentally activated by straining to go in the toilet, bad news, psychologically or physically stimulated. And then people, because they would slow down their heart rate and dilate their blood vessels, would drop their blood pressure and they would faint. We said fainting is called syncope or syncopize, and that we always have to examine and make sure there's no trauma or they didn't hurt themselves when they fainted. And that usually people with vasovagal will recover, okay, because it was a problem that once they fainted was corrected, right? If they saw blood, once they fainted, they didn't see the blood anymore, they start to correct themselves unless they hurt themselves on the way down. And usually within about 15 minutes, they start feeling better. And we know they start feeling better when we see their heart rate climbing back up towards a normal number. And then when they could sit up without feeling dizzy, then we stand them up. And if they still don't feel dizzy, then they're usually fine. The digestive system, we said, is the system that processes food through our digestive system to get the nutrients, the good stuff out of there, the vitamins and the sugar and everything we need. And it starts by putting food in our mouth and chewing it, swallowing it into our esophagus. Our esophagus puts it down into our stomach, and our stomach starts the process of breaking it down further by acids and bacteria. It then, after it breaks it down a little further, puts it into your small intestine, where it starts to draw out all the good stuff. And how it draws out the good stuff, right, is that the capillaries of the digestive system are in close contact with the walls of the intestine, and that the sugar and all the good nutrients, all the good food, travels out of the intestine into the bloodstream, and the bloodstream obviously transports it to all the different cells of the body to feed it. Okay, and that happens in your small intestine, your large intestine. Pretty much your large intestine mainly takes out water. Okay, and then once it's by the end of your large intestine, it's pretty much the waste product that when you go to the bathroom, you send out of your body. And once it's leaving your large intestine, it goes into your rectum, which is the storage of where your poops goes. And once your rectum is stretched enough, you feel like you have to go to the bathroom, and then the feces of the stool leaves your body from your rectum through your anus and outside your body. Okay. And then we had I actually added one in here. Your immune system is a system that protects your body. So your immune system is kind of like your army that protects your body from infection. And we found with COVID that sometimes the problem could be is that the immune system does too good of a job and gets too crazy in trying to protect you. And they're finding now with COVID that it's actually that your immune system is getting too crazy and actually damaging the body by trying to protect it. And we said there's different parts to your immune system. And over the last couple of nights, we talked about your white blood cells playing a role in infection control, and also your lymphatic system playing a role in infection control. And then we had your integumentary system, which was your skin. And we said your skin also plays a role in infection control. It plays a role in controlling fluids, temperature, and so on. That we had different linings of the skin. We had the outermost layer, mainly composed of dead skin cells. That's called your epidermis. Then we had your middle layer, which is the thickest layer, called your dermis. That's where most of your blood vessels are running through. And then we had your innermost layer right above your bones that are called your subcutaneous. And that's your fatty layer that acts as insulation and protection and cushioning. And we talked about that if there were burns, right? Well, when we do trauma, that the burns to the epidermis would be called superficial. The burns to the middle layer, the dermis, would be called partial thickness, and the burns that go through all the different layers of the skin, okay, all the way to the bone, would be called superficial, partial, and full thickness burns. Okay, we had your endocrine system, which is a series of chemicals that are released into the bloodstream. The two that we have to know on an EMT level would be adrenaline, being the chemical of the sympathetic nervous system that speeds everything up when there's an emergency, and insulin, okay, which is the chemical secreted by the pancreas that is the transport mechanism for sugar. So it's kind of like the wheelbarrow that carries sugar to the door of the cell and allows it to enter into the cell to be used. So again, you need to have insulin. Okay, just eating food and getting sugar into your bloodstream is not enough to get that sugar from your bloodstream into the cells. You need insulin to transport it. So we said insulin is produced by the pancreas, and adrenaline, the emergency one for the sympathetic, is produced by your adrenal glands that sit on top of your kidneys. Your renal system was your kidneys to cleanse the blood, and that once the renal system cleans the blood, it sends it via tubes to your bladder. And then once your bladder is full enough, you feel like you have to urinate, and the urine goes out of your body. And the reproductive system, mainly again on the test, it's for women, right? And we said that it's basically composed of an organ called your uterus, which is a muscle that the baby is housed in, and it expands from the size of a woman's fist to whatever the size of the baby is. And that when the baby is fully grown, which is around 38 to 40 weeks or 9 months, the uterus starts to contract, okay? And the opening to the uterus into the vagina, called the cervix, opens up and dilates. And the baby, as the muscle contracts, the baby is pushed out of the body. And that there are two organs called ovaries, that are the egg-producing organs. And they release one egg a month, okay? From the ovary into the fallopian tubes, which are tubes that connect the ovaries to the uterus. And if everything goes according to plan, the egg is released from the ovary into the fallopian tube. The woman has had sex, and sperm is injected into the woman, floats up and swims up the uterus into the fallopian tube, meets with the egg, pierces the egg, and the egg starts to divide and become the baby. The egg continues to travel down the fallopian tube and falls into the uterus, lodges, and develops into a baby. If it lodges in the fallopian tube, that's an emergency called an ectopic or tubal pregnancy. And the reason it's an emergency is that the egg can continue to grow in the fallopian tube and rupture the fallopian tube. And running along the fallopian tube is the fallopian artery and fallopian vein, and it can cause severe hemorrhage. So that's everything in a nutshell. So let's see let's see if anybody has any other questions. Okay.
Talking about urinating.
Okay, let me just do the ones that are here. Okay, we did this one. So here's a good one. Why is a paper cut so painful? Okay, is it that it cuts through many layers? So mainly a paper cut only cuts through your epidermis, your top layer. And the reason it's so painful is that your top layer of your skin is where all your nerves are. So your nerve endings, right? Your sensory nerves that feel heat and feel pain and feel, wetness and feel this. That's where they all are, right? Because that's the outside of your body. So that's where your senses are. So that's why a paper cut is so painful. And believe it or not, some people believe that we have chemicals in our body that are pain relievers, better pain relievers than OxyContin and all the different pain medicines that you see doctors prescribe. They're called endorphins, right? And that they say that a paper cut would be so painful to someone that they would actually die from it if it wasn't for these endorphins. And the reason it's so painful is, again, because you just have so many sensitive nerves, okay, on the outside layer of your skin. That's, again, why a burn is so painful, right? Why is a sunburn so painful? Because you have thousands and thousands of nerve endings that are screaming in pain because they were cooked, right? They were burned. So that's a good question. Okay. So that was that. So, okay, now everybody can ask some questions.
Going back to urinating.
So just one thing before I answer these. So all you guys that are looking at your phones and smiling, I assume that you're looking at stuff that is educational. Now you're looking up at me, but I assume that you're looking at stuff that's educational and not some funny video you shouldn't be watching. Remember, we have these we could have the Rebbeim looking in on the YouTube videos and stuff. Okay, so go ahead, because those are all public. So somebody actually watched the one from the other night where I talked about Shunt, and they called me up and said, "Oh, I remember Shunt in class." I said, somebody from a previous EMT class. I said, I have to watch what I say in class. Okay. So somebody wrote here, the feeling I got from a potch from my teachers many years ago, was it the skin hurting or blood related? Again, it was the nerves feeling the pain. Okay, so what's your questions?
Question is about urinating, the difference in yellow and clear.
Okay, good question. So if you were well hydrated, your urine would be totally clear. Wouldn't have any yellow, anything to it. So if you see dark yellow, it means you did not drink enough water that day. And I would tell you that none of us drink enough water. Okay, and anybody who starts getting a headache around 3 o'clock, 6 o'clock at night, it's because you didn't drink enough. Okay, that's the most common reason we're a little dehydrated. Most of us go through the day dehydrated, especially if you drink a lot of caffeinated beverages like coffee and tea and Coke and all that stuff. So yes, your urine should be completely clear, and that means you have good kidney health. If your urine is clear, it means you got lots of fluid, clear, nice, clean fluid running through your kidneys, and you're taking good care of your kidneys, and you probably will not develop later in life any problems with your kidneys. And you won't get kidney stones, and absolutely. You should drink about 4 to 5 bottles of this water every day. Okay, and that's a good way to start the day. Put 4 bottles of water on your desk, and just make sure that by the time you leave work, you've emptied all 4 of them. You've actually, I shouldn't say emptied them, but you've actually drank all 4 of them. Okay. What else? Any other questions? Okay. Please read. Okay. It's not going to be enough to listen to me. I know I say it every night. Okay. But you have to read. If it don't make sense, I will answer the questions for you. So today I only got no phone calls and maybe 5 or 6 texts. So I was a little surprised because, I'm sure tomorrow I'll get more because, we went over a lot of stuff today. But if there's stuff you're not understanding, please call me up. Okay. If you don't want to call me, call Yankee, call David. But, definitely if there's stuff you don't understand, reach out so I could explain it to you. And I don't know, just keep on plugging away. We're going to have 1 or 2 more nights of this kind of stuff. And then we'll be getting into, more of the emergency stuff, right? We're going to probably from this go on to airway, talk about using oral airways and nasal airways and suction and bag valve mask and, all the different stuff. So it'll be more of, probably what you signed on for when you took a EMT class. Okay. Any questions? Anything? Okay. So everybody have a good rest of the week. Have a good Shabbos. Stay dry. We're going to get a lot of rain. And we'll pick up again next Tuesday night. And if for some reason I'm a little delayed, I will send out something on WhatsApp. Okay. But I will be on. So if you sign on and I'm not there, just have patience. I will be there at some point. Okay.
Do we got any, you mentioned something about Motzei Shabbos. Is it this week or the coming one?
So this week Shabbos is out regular
You didn't
time.
listen well. You didn't listen well. You said that this week is still not late.
Yes. So I mean, I technically, unless my wife has something for me to do, I could sign on if people want to. I tell you what, if people are bored after Shabbos and you want to do it, send out something on WhatsApp, And, you know, if you want to have a quick little review class for a half hour or an hour or something like that, we can do it. But really, the following week, Shabbos is going to be out pretty early, and we'd have plenty of time. So, you know, stuff. So you got to figure I probably would want to be done this week by, like, say, 10 o'clock. So we maybe do 9 to 10 this week, if that's good for people. And then, you know, the following week, Shabbos is out so early, we could probably start even like 8:30 or something like that. I don't know time. Okay.
Thank you. Good job.
Okay. Everybody have a good night. And I'll upload everything when I can. Okay.
Thank you for uploading on Dropbox.
No problem. Be well.
Have a good job.
Take care.